Imagine a sunny Sunday morning breakfast at a family home. The table is set, laughter fills the room, and suddenly, Grandpa Joe, who was just passing the syrup, freezes. His face droops on one side, and the syrup bottle slips from his grasp, shattering on the floor. The family, initially stunned, quickly realizes something is terribly wrong. This is not just a minor mishap, it's the beginning of a life-threatening medical emergency known as a stroke. This scenario is not uncommon and illustrates the suddenness with which strokes can strike, affecting not just the individual but also their loved ones. Strokes are a leading cause of disability and can be fatal if not promptly and properly treated. Understanding what a stroke is, recognizing the symptoms, and knowing immediate actions to take can make a significant difference in the outcome. Strokes manifest in various symptoms, which we will explore in detail, but common signs include sudden numbness, confusion, and trouble speaking. Recognizing these signs early can be the key to saving a life. The impact of a stroke can be profound, not just on the victim's health, but also on their emotional and financial well-being. The urgency of recognizing and correctly responding to a stroke cannot be overstressed, as every minute counts in reducing the severity of its consequences. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke is a medical emergency, and prompt treatment is crucial. Early action can reduce brain damage and other complications. There are primarily two types of strokes: ischemic, caused by blockage of an artery, and hemorrhagic, caused by bleeding. Both types disrupt the brain's functions by damaging its cells, but their causes and treatments differ significantly. Understanding these can help in recognizing the kind of stroke occurring and deciding the immediate course of action. The effects of a stroke can be temporary or permanent, depending on how long the brain suffers without blood flow and which part was affected. Functions such as muscle control, speech, and other sensory activities can be impacted. This makes it imperative to understand the biology and the symptoms of strokes. Despite advances in medical science, strokes remain a leading cause of death and long-term disability. This highlights the importance of education on stroke symptoms and immediate response techniques, which can literally mean the difference between life and death, or full recovery and significant disability. Recognizing the signs of a stroke can be remembered by the acronym fast face drooping, arm weakness, speech difficulties, and time to call emergency services. These symptoms typically appear suddenly and are easy to identify. Face drooping on one side or an uneven smile, arm weakness or numbness, and slurred or strange speech are clear indicators of a stroke. Vision problems, such as blurred or double vision, and severe headaches with no known cause, are also common symptoms. Sometimes these headaches are accompanied by dizziness, vomiting, or altered consciousness, signaling a possible stroke. The importance of recognizing these symptoms cannot be overstated. Quick identification leads to faster treatment, which can prevent severe brain damage and increase the chances of a full recovery. Educating the public to recognize these symptoms and react promptly remains a cornerstone in the fight against strokes. Campaigns and education on this front can save lives and improve outcomes for stroke victims.
Section 5. Immediate actions. What to do in a stroke emergency. When a stroke is suspected, the immediate response should be to call 911. Time is brain and stroke treatment. The faster the medical intervention, the better the chances of recovery. Documenting the time when symptoms first appeared is crucial as it can affect treatment decisions.
The importance of timing in stroke response. The concept of time is brain emphasizes that during a stroke, every minute counts. Approximately 1.9 million neurons are lost for each minute a stroke is untreated. This rapid loss of brain cells can lead to irreversible damage, impacting motor skills, memory, and even personality. Immediate medical treatment not only helps in salvaging the brain tissue but also in reducing the complications that can arise from a stroke. Can drastically reduce the time it takes for a stroke victim to receive care. This education is crucial in high-risk populations and in areas where medical facilities are not readily accessible. Therefore, community health initiatives should focus on stroke education as a major priority to ensure that everyone understands the critical importance of time in treating stroke. This can lead to better outcomes and a decrease in stroke-related disabilities.
Section 7. Prevention strategies. Lifestyle choices. Preventing a stroke starts with managing the risk factors. A healthy diet rich in fruits, vegetables, whole grains, and low in saturated fats can help reduce the risk of stroke. Regular physical activity, maintaining a healthy weight, and controlling cholesterol levels are also crucial. Smoking and excessive alcohol consumption are significant risk factors for strokes. Quitting smoking and moderating alcohol intake can markedly reduce one's risk. Additionally, managing stress through techniques such as yoga, meditation, or even regular exercise can help reduce the risk of a stroke. Diet and lifestyle choices have a profound impact on blood pressure and diabetes management, both of which are significant risk factors for strokes. Regular checkups to monitor these conditions can help manage them effectively and reduce stroke risk. Lifestyle modifications are not just recommendations. They are necessary changes that can save lives. These preventive measures are among the most effective ways to reduce the incidence of strokes globally.
Section 11. Conclusion and call to action. Strokes are a major health issue globally, but awareness, prompt response, and preventive measures can significantly reduce their impact. Recognizing the symptoms quickly and acting fast can save lives and reduce the severity of the consequences. We call on everyone to educate themselves and others about the signs of a stroke and the importance of immediate response. Subscribe to health channels, participate in community health programs, and spread the word about stroke prevention and response. Together, we can make a significant difference in the fight against strokes. Let's take action today to protect ourselves and our loved ones from this life-threatening medical emergency.